Well, we've got some breaking news here on McBLOG. When the Ministry of Health says something is safe, but then decides, no, it may not be safe, you'd think they'd tell you, but they didn't. And that tells you everything about how interested in health some of the ministry really is, and how much activism is going on. Let's check it out. All right, so here's what the Ministry of Health official website says about puberty blockers for teens wanting to change their sex. Puberty blockers are a safe and fully reversible medicine that may be used from early puberty through to later adolescence to help ease distress and allow time to fully explore gender health options. Notice that there in the second paragraph, safe and fully reversible. And here's what the expert said on TVNZ's Sunday program when that program pushed a pro-transgender narrative recently.
I know, just a little bit sharp, doing real good.
Good boy. Nearly there.
The price to be his true self.
Ow, that one
Almost
hurt.
done.
Ouch, 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 ouch.
You're doing real good though.
So that's where puberty blockers can be helpful.
A medical intervention.
Puberty blockers, they turn off the sex hormone production, and by doing that, it stops puberty moving forwards.
And are they reversible?
So yeah, absolutely.
Have it like that.
Safe and reversible, apparently. Well, medical professionals and medical groups, including the Royal Australian and New Zealand College of Psychiatrists, they recently sounded growing international concern around the use of puberty blockers to treat young people with gender dysphoria because of the low certainty of benefits, but the significant potential for medical harm. Britain's NHS recently withdrew a claim that the effects of puberty blockers are fully reversible. Sweden's leading gender clinic recently ended routine treatment of minors under the age of 18 with puberty blockers and cross-sex hormones. Finland revised its treatment guidelines in June 2020, prioritising psychological interventions, counselling and support over medical interventions, particularly for young people. And the Food and Drug Administration, the FDA in the US, recently issued a warning label about the risk of puberty blockers. Here's what the UK Ministry of Health, it's called the National Health Service, officially says on their website. Little is known about the long-term side effects of hormone or puberty blockers in children with gender dysphoria. Although the Gender Identity Development Service advises this is a physically reversible treatment if stopped, it is not known what the psychological effects may be. It's also not known whether hormone blockers affect the development of the teenage brain or the children's brain. That's pretty disturbing, isn't it? In fact, the UK's Tavistock Transgender Clinic was recently shut down by the UK's Ministry of Health after a review found it's not safe for children and that there's insufficient evidence to recommend puberty blockers. And you may remember the name Kira Bell, a case that went to the High Court and then the Court of Appeal in the UK, and an expert in child and adolescent psychiatry who gave expert evidence in the British High Court regarding Bell's harmful transitioning believes that prescribing drugs to delay puberty is a scandal and tantamount to conducting a live experiment on vulnerable children. And he said, quote, "In my years as a physician, I cannot remember an issue of greater significance for the practice of medicine. We have left established evidence-based clinical practice and are using powerful life-altering medication for a vulnerable group of adolescents and children based upon a belief." So let's revisit what the Ministry of Health said. Puberty blockers are a safe and fully reversible medicine that may be used from early puberty through to later adolescence to help ease distress and allow time to fully explore gender health options. But last Friday, when no one was looking, the Ministry of Health sneakily changed the page to this. Blockers are sometimes used from early puberty through to later adolescence to allow time to fully explore gender health options. This is done under the guidance of a clinician who specialises in their use. Now, let me just put those two side by side. Note the difference. They're no longer safe and fully reversible. And that is quite a significant admission. It's a good decision. But they weren't that keen on letting you know that. And the only reason we happened to find out was because the group Speak Up for Women put out a media release. But we couldn't find any media talking about it, eh? You know, we're calling on the New Zealand Government and the Ministry of Health to pause the use of puberty blockers, cross-sex hormones, operations for minors while further research is undertaken. And that's actually a sentiment supported by a majority of New Zealanders and an increasing number of medical groups here and overseas. It's time we put a first do no harm medicine and credible research ahead of ideology and an agenda to push gender fluidity indoctrination. It's time we had watchful waiting, therapy and healing of the mind rather than chemicals and castration.